and it is time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're going to be talking about depression. Depression is really such a huge topic. It's one of many diseases that come under the bracket of part of mental illness. Depression is actually the leading cause worldwide of disability. And often when we think about disability, we think about maybe not being able to see or hear or not being able to walk. But actually, illnesses that start to affect the mind, they affect how we function everyday life. It affects our motivation, our relationships, and our decision-making capabilities. And so if that is affected, of course, it will start to cause us to have some disabilities. Now, what has really been nice over the last few years, we're seeing that mental health is being talked about more and more. It's becoming more prominent in the media, social media, more mainstream media, and in between people as well. You'll notice that people are starting to talk more about their mental health. But even though that's the case, there are still some areas where not enough information is out there, or there's a bit of a lack of understanding, and depression is definitely one of those areas. A lot of us will experience low mood or feeling sad or down for a period of time, but that doesn't always mean it's depression. And because so many of us actually experience that feeling of low mood or sadness, we often start to think that, oh, well, we understand depression, we've all gone through depression. And that kind of sometimes leads to some trivialising what real clinical depression is. And so today's video, I wanted to talk about what is depression, some of the symptoms that are associated with it and how we can diagnose it, the differences between mild, moderate and severe depression, and also how we treat it. Depression is defined as low mood that lasts weeks or months and affects activities of daily life, affects your daily functioning. Now, those two parts of that definition are what differentiates depression, clinical depression, from just an episode of feeling quite sad. It's about the duration of time and also the way in which it affects your ability to function. So not too long ago, I was actually in a tutorial, a group seminar about depression, and actually it's about mental health and mood disorders as a whole. And the person leading that tutorial was a psychiatrist, and he said this sentence that really resonated with me to distinguish between actual depression and just feeling quite sad or low. And it was that feeling sad or low, there's usually a trigger that happens before you have a depressive episode or before you're having a period in your life where you're feeling quite down. But the difference is when you're low in mood or when you're down, and it's not quite depression yet, it's more of a moment of agony. And it can feel really, distressing if you've gone through a divorce or a bereavement or a job loss, or you're going through, any kind of grief. Then often, yes, you can have this really low feeling, and it's like a moment of agony, and it can be very painful. But with depression, it's not just this moment of agony, but it's a moment of agony that stretches across eternity. And if you've gone through depression, or if you're suffering with depression right now, that last part that stretches to eternity is often something that might resonate with you, feeling like this is an all-encompassing kind of disease, an all-encompassing feeling of low mood that you really can't shake by yourself. And so that's really the difference between depression and low mood. With depression, there are core symptoms though, and that helps us as doctors to diagnose it. And I think if you understood what the core symptoms are and some of the associated symptoms of depression, it will help you to have a bit more insight into whether you fit into that category where you need to seek more professional help, or if you're more on the low mood side of things. So there's two core symptoms of depression. The first is feeling down, depressed, or hopeless. And hopeless, really, that word is one of the things that I see being one of the most prominent things, this hopelessness, not seeing a way out, not seeing a future. It doesn't mean there isn't one, but when you're actually in that clinical part of depression with a lot of my patients, the hopelessness is something that can be quite intrusive. The second core symptom is a loss of enjoyment or pleasure in doing things that you used to really find enjoyment in, whether that's a hobby or sitting with your friends or being with your family, or if it's travelling, but there just doesn't seem to be that same enjoyment that used to be there. Now, it's not enough just to have these two core symptoms. You can actually just have one of them, but it's also about the duration that they're there for. If you find that you're not really enjoying things that you usually do, you're trying to read a book, you're not enjoying it, or a TV show, it's just happening over a couple of days and then you start to pick up, that wouldn't be clinical depression. Or if you have a day where you're feeling quite hopeless and down, depressed, but then things start to change and pick up, then that also isn't depression. If you have one of these core symptoms but they last for 2 weeks and you're feeling that the majority of the time, that's when we start thinking, is this person suffering from clinical depression? Although there are those two core symptoms, there are actually quite a few associated ones that come along with feeling depressed. And I'll take you through those now. So the first one is about sleep. There's usually some kind of disturbance of sleep, whether that's an increased amount of sleep, that you're sleeping away the day, or if it's that your sleep has decreased. And often people with depression might complain about trouble falling asleep, or what we call early morning waking, or waking up through the night. Some kind of disturbance in the sleeping pattern, which is normal for you. The second is appetite and weight. They go hand in hand, really. So sometimes you might find that you're eating more than usual and gaining weight, or that you're not eating very much at all, that you've lost your appetite and the weight is starting to drop off. You might find that you have a tendency for one or the other. If you're going through a stressful time, such as an exam or something happening at home, some people might start to comfort eat and find comfort in eating chocolate and different things like that. Or some people might lose their appetite completely. I, for one, when I am going through a stressful time, I start to comfort eat, and it's actually quite obvious when you look at my graduation pictures. You can tell that my final year of med school was a little bit stressful because I'm a bit bigger than I usually am. So that's another one of the associated symptoms with depression. The next one is a change in your movements. Some people might be more agitated and their movements become like that as well. So it might be that you find yourself bouncing your leg a little bit more, or looking around a little bit more, just feeling more agitated. Or it might be that your movements slow down, that you find it really hard to get motivated and get out of bed. Getting dressed takes you a long time, or walking anywhere takes you a long time to do those activities. That's another sign. Next is fatigue or a loss of energy. It's quite common to have with depression. And also trouble making decisions, or having trouble concentrating, maybe having a conversation with somebody but you just can't follow what they're saying, or people are presenting you with options, or you've got options and you just can't seem to make that decision. That's another associated problem with having depression. In addition to all of these, there's also this feeling of worthlessness that people often allude to, or a feeling of guilt about everything. And it's not just guilt when it's warranted, but it's this inappropriate and excessive guilt that people with depression often do comment on. And finally, the part of depression that really is quite serious, and all of these things are serious, but one that really is a red flag for me as a doctor is hearing about, a red flag for anybody hearing about this, I'm sure, is suicidal thoughts. There's a big spectrum how suicidal thoughts can actually show itself in depression. It may just be a fleeting thought that comes here and there that, maybe it'll be better if I wasn't here. Or it might be a more intrusive thought where constantly you're thinking about, I need to end my life. Or it might even develop to the point where you're making plans and writing notes. But this really, the risk of suicide or these suicide tendencies and thoughts are also another part of this depressive illness. So when we're looking at depression as a whole, it's actually very beneficial to classify somebody's depression as mild, moderate or severe, because it really does help to direct how in which they need treating or what help is needed. Now, the way in which those classifications are done are by looking at two areas. First is about functioning in daily activities, and the second is about suicidal risk or suicidal thoughts. Now, the milder side of depression is all the symptoms that I described, and it's not that you have to have all of them, but usually there is some kind of mixture of the ones I mentioned earlier. With mild depression, what we see is that you're still able to function, mostly. You're still able to go to work, and yes, you might find some activities difficult, but on a whole, you're able to manage yourself. And you might have some thoughts about suicide, but they're very fleeting thoughts, easy to ignore, and it doesn't lead on to making any plans at all. With moderate depression, we find that those activities of daily life start to become a bit impaired. You may struggle to go to work and need a sick note, or you're taking time off, avoiding some social activities, or struggling to keep up with the house. And those thoughts about suicide, they're no longer just fleeting ones, but they're ones that are there, and they're often quite regular when they're coming in. And finally, severe depression. This is where functioning and daily life activities really diminish. And not only do you struggle to keep up with some of your responsibilities, such as work or looking after the home, you actually start neglecting yourself as well. And along with the neglect of yourself and everything around you, and not keeping up with your responsibilities, those thoughts of suicide become even more intrusive and often can lead to plans of suicide or attempts. So the reason why categorising depression is just so important is because it really helps direct how we manage depression. Often depression can be managed quite well in general practice, those that are on the more mild to moderate side. But once we get into the moderate to severe and severe side of things, we often need a bit more support, and that's where referral to a psychiatrist and to secondary care comes into play. In addition, it also helps us to know how quickly they need to be seen. If somebody's just having fleeting suicidal thoughts, often it can be managed quite well here. But if someone's starting to have those really intrusive thoughts, or they're starting to plan how they're going to end their lives, that tells us how quickly they need to be seen. But the majority of depression is actually treated in GP. And there's actually lots of options that your family doctor can do to help you with depression. And often when we think about depression, the first thing that comes to mind is antidepressants, and they most definitely do play a role. Actually, once you're having those symptoms of depression for that duration of time of 2 weeks or more, it starts to suggest that there is a chemical imbalance happening in the brain. And that's where antidepressants come in play, to try and help to level out that imbalance. But antidepressants are only half the story. They only do what I call 50% of the job. The other 50% really comes from a lot of hard work on your behalf as the person suffering with depression. Now, that's hard work in terms of finding out what the triggers are that led you to this point, and looking at some of the behaviours that you're having that's keeping you in this state of depression, and looking at some of those protective behaviours that you do that can take you out of the state of depression. So if you haven't already, please look back at one of my previous videos called Mental Health. In that video, I talked to you about the 4 Ps, to introduce you to something called the 4 Ps. Now, the 4 Ps are factors in our life that happens over the course of time that may increase or decrease our likelihood of having mental illness. If we're able to understand those 4 Ps, we can often put behaviours and practices into place and lifestyle changes that will help to treat depression. So please check out that video for more information. In addition to these behavioural and lifestyle changes, we also have something called therapy. This is where you go and talk to a trained professional who has dealt a lot with people with mood disorders, depression, or other psychiatric problems. And in therapy, you're able to unpick some of those past childhood traumas or what some of the triggers were to bring you to this state of mental illness. Also with therapy, we can have a look at some of the behaviours that we're doing now and think about strategies that we can do to help bring us back to a state of mental well-being. Now, I'm not a therapist, but I have seen a counsellor, and I can talk from personal experience about how beneficial it has been. But because I'm not a therapist, I don't know all the different types of therapy that's out there. And I would love to have a therapist come onto this channel and talk to you about some of the different options there are for therapy and the way in which you can access these. If that's something you'd be interested in, please leave a comment down below, and I'll make sure that I can, rustle something up and bring that content to you. Now, after therapy and the lifestyle and behavioural changes, yes, antidepressants most definitely do come into play. But I'll be honest, for me, if you don't already have a previous history of depression and this is the first time meeting you, I'm very unlikely to start you on antidepressants. And the reason for that is because antidepressants, if you start them straight away, they often put such a big pressure on antidepressants to do all the work. Whereas the lifestyle changes, the therapy, are things that need to happen first. And sometimes we even find that just having a time of watching and waiting and seeing how these symptoms progress, a lot of people will get better, even just by having initial contact with their GP and having that first talk. Antidepressants are great, but there are some people that are on antidepressants for years and years and years, and they rely on them to be able to function in everyday life. And yes, that is something that some people need, but a large proportion of those that are on those antidepressants for such a long period of time aren't using them correctly. And the whole topic of antidepressants really is quite a big one. There's a lot to talk about in terms of how to use them, the side effects, how long you should be on them. And so I'd love to do a video about antidepressants in the future. But we have covered a lot today. We've spoken about depression, what it is, the definition of it, the difference between depression and low mood, and the symptoms that come associated with it. We've talked about how to categorise it from mild, moderate and severe, and even touched on some of the treatment options. I really hope this video has been interesting and informative for you and that it has helped. If you have any questions, comments, anything, please leave them down below. I'd really like to hear from you. And if it's been helpful, don't forget to subscribe, like and share with your family and friends. Take care.